During this video, we'll explain how breast lift surgery is done. During a breast lift procedure, excess skin is removed, the breast tissue is reshaped, and the remaining skin is tightened. Also, large areolae may be reduced in size and moved to face forward. Your surgeon will assess the degree of sagging of your breast to determine the type of breast lift procedure that's best for you. The scar length and position will depend upon your breast size and degree of sagging. There are 4 basic breast lift techniques used to correct various degrees of sagging. The crescent, or periareolar technique, involves a crescent or half-moon-shaped incision made around the top of the areola. This technique leaves a smaller scar but achieves only a minor degree of lift. This technique is appropriate for women with small breasts or minor breast sagging. The circumareolar or donut technique involves a circular incision made around the areola. This technique leaves a small scar but achieves a small degree of lift and can be used to reduce areola size. This technique is appropriate for women who have small breasts or minor breast sagging. The vertical or lollipop technique involves a V-shaped incision that extends around the top of the areola and down the midline of the breast. This technique has a larger scar but achieves a large degree of lift. This type of incision is appropriate for women with larger breasts and moderate to severe breast sagging. Finally, the anchor or inverted T technique involves an anchor-shaped incision that extends around the top of the areola and across the lower portion of the breast. This technique has the largest scar tissue but achieves the greatest amount of lift. This technique is appropriate for women with large breasts and severe breast sagging. During this animation, we'll demonstrate the anchor technique, as the other techniques are similar in principle but have smaller scars. Before the procedure, your surgeon will use a pen to draw incision guidelines on your breasts. This is your final opportunity to discuss scar length and position with them. Ideally, you should discuss this in detail well before the day of the surgery. To start, anesthesia will be administered. This procedure can be done with general, regional, or local anesthesia. Full details will be included in the written consent information. It's a decision between you, the surgeon, and the anesthesiologist after considering your personal requirements. You'll be placed flat on your back on a special soft mattress. The surgeon will make an incision or cut along the pre-marked lines. The skin will be separated from the breast tissue below. An implant may be inserted at the same time to enhance the shape of your breast. This can be placed under or over the pectoral muscle beneath the breast tissue. The breast tissue is tightened and lifted using stitches or sometimes a mesh for extra support. The extra skin is removed and the new edges brought together to form the outline of the new breast contour. Next, the nipple and areola are slid into their new higher position. This will be done to both breasts, and the surgeon will examine and make alterations to achieve symmetry or as close to symmetry as possible. When satisfied, the incisions will be closed with sutures. A surgical drain may be left inside each breast to remove excess fluid. Dressings will be applied to protect the wound. You may be fitted with a compression dressing or bra to protect the wounds and new breast contours while they heal. You'll get personalized post-operative instructions on drain and suture removal. The whole chest area may be bruised, swollen, and discolored over the first few weeks. In time, this will settle and the incision lines will fade. However, it's important to realize that there will be permanently visible scars. There may be some pain or numbness near the incision lines. You may continue to notice a change in the appearance of your breasts as swelling decreases. It may take up to 1 year before the final results from your procedure are apparent. A breast lift cannot stop the aging process, but it can restore a more youthful contour to your breasts. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.